Okay, this is for practical 3.H.19, ailments to the circulatory system. We're just going to talk about some illnesses of the circulatory system. Our first one is perioplasmosis. Now this is caused when parasites are transported from one horse to another via ticks. Now the symptoms of this are varied. The horse may have swelling in its head, legs, abdomen, and maybe in its chest. The horse may be constipated, jaundiced, have red urine, be depressed, have a fever, loss of appetite, pale mucous membranes. It may become anemic and display signs of colic. Now treatment for this is you'd need to consult your vet and they would administer medications and a blood transfusion to help treat this. Now our next one is hemolytic disease. I don't think I've said that correctly, I apologise. Now this is caused by the differences in the structure of the foals, of a foal and its mother's red blood cells. Now symptoms that this is present in a foal, the foal become inactive and sleepy, and when it exerts itself through exercise, its pulse and its respiratory rate will increase very, very quickly. Now the foal may be jaundiced in its mucous membranes and also the whites of its eyes. And it also may have red urine. Now treatment for this depends on whether you catch it before or after birth. Now after, and if the foal sucks off its mother, you'd need blood transfusions to help rebalance the red blood cells in the foal. And then you'd also restrain the foal from further sucking off its mother. If it was determined prenatally, what you'd do is when the foal was born, you'd restrain it from sucking off its mother altogether, and then you would feed it the colostrum of another mare, and then you'd probably have to hand feed it, which would really, really suck. Okay, the next one we're going to talk about is cardiac tissue defects. Now these are caused from a few different things. They can be the heart tissue can be damaged from worm larvae. There may be growths on the valves of the heart. There may be immune system reactions or bacterial infections. Some of the symptoms of cardiac tissue defects is when you listen to the heart through the stethoscope, there may be friction noises, may be able to be heard. It'd cause a build-up of blood pressure and congestion of the circulation in the lungs. So it might make the horse have laboured breathing. And it also affects the gaseous exchange within the horse's lungs as well in the airways. And the horse may develop a exercise intolerance. Now some of the treatments for cardiac disease, now this is usually self-resolving, but it can result in death. So early diagnosis would mean that you'd rest the horse, and once it's, if it was caused by, for example, infestations or viruses, you'd wait till they had recovered from that before you'd resume exercise, and you just monitor their heart so that you can see if those symptoms have resolved themselves. Okay, next we have our myocardial disease. Now this is caused by exposure to viral or bacterial respiratory infections, and it can also be a reaction to drugs or vitamins or an electrolyte imbalance as well. Now some of the symptoms of myocardial disease are reduced or poor athletic performance and ability of the horse, poor pulse. Some might be hard to hear and not very steady, and may have developed arrhythmias, and you'd have an increased pulse rate. Now treatment of myocardial disease, well, it would need to be diagnosed by your vet, possibly blood tests as well to see what the cause of it was, and then the horse would need long-term rest to help it overcome the illness. Now the next one we're going to talk about is epistiotaxis. Once again, I don't think I've said that correctly. Now this is caused by fast exercising that has induced hemorrhaging, and it's caused by stress to the lungs with forceful breathing. It can also, some of the less common causes are tumours or foreign bodies stuck up in the horse's nose, or a fungal infection, or maybe even a fracture to the horse's skull. Some of the symptoms is usually bleeding from one or both both nostrils. Now, if it is caused by those less common causes like your fungal infections or fractures to the skull, or a tumour, the horse might have difficulty swallowing, and there might be a foul-smelling discharge, maybe coming from the nose as well. Now, treatment of this, basically you'd need your veterinary diagnosis. You'd cease exercise until you got to the root of the problem and the horse was over it as well.